In 2024, a commission of the world's leading dementia researchers published a report that should have made front-page news everywhere. They identified 14 specific modifiable factors responsible for nearly half of all dementia cases worldwide. Not genetic factors, not factors you are born with and cannot change. Modifiable factors, things happening in your daily life, in your body, in your habits, that are quietly building toward dementia or quietly protecting you from it, depending on what you do about them. The other finding in that report that almost nobody is talking about, the damage begins 20 to 30 years before a single symptom appears. The person who receives a dementia diagnosis at 75 began accumulating the brain changes that led to it in their late 40s and early 50s, often without any warning sign they would have recognized. Which means the most important time to act is not after a diagnosis, it is now. Wherever you are watching this from, whatever your age, today I am going to walk you through every one of those 14 factors, what each one does to your brain, why it matters at your specific age, and what you can realistically do about each one. Not vague advice, specific actions. Stay with me through all of it, because the factor that has the largest impact on your personal risk may not be the one you expect. I am Dr. Hameed Ullah Shaheen, and dementia prevention is one of the areas of medicine where the gap between what the research tells us and what patients are actually told is widest and most consequential. Most people think of dementia as something that either runs in the family or does not. Something inherited, something fated. The evidence says something very different. Nearly half of all cases are the result of factors that were present, addressable, and missed. Let us go through them systematically. Before the 14 factors, one essential piece of context. Dementia is not a single disease. It is the endpoint of a long process, a decades-long accumulation of damage to brain tissue, blood vessels, and neural connections that eventually reaches a threshold where cognitive function is visibly impaired. The most common form, Alzheimer's disease, involves the abnormal accumulation of two proteins, amyloid and tau, that disrupt communication between neurons, trigger inflammation, and ultimately cause neuron death. This accumulation begins 20 to 25 years before any symptom appears. Vascular dementia, the second most common form, results from progressive damage to the small blood vessels supplying the brain, reducing the oxygen and nutrients that neurons depend on. This damage accumulates over years of uncontrolled blood pressure, blood sugar, cholesterol, and inflammation. What the 14 modifiable risk factors have in common is that they accelerate one or both of these processes, and addressing them, at any age, but most powerfully before symptoms appear, slows or stops the accumulation. That is the framework. Now, the factors. The connection between hearing loss and dementia is one of the most robust findings in recent neurological research, and one of the least discussed in clinical appointments. Untreated hearing loss raises dementia risk by approximately 50%. That is a larger effect than almost any other single factor on this list. Two mechanisms explain it. The first is neural deprivation. Your brain is not a static organ, it is maintained by use. Neural pathways that carry auditory information remain strong only when signals are regularly traveling through them. When hearing deteriorates and the auditory input narrows, the brain regions that process sound receive progressively less stimulation. Under the brain's fundamental operating principle, use it or lose it, those regions begin to atrophy. And atrophy in one region does not stay contained, it spreads. The second mechanism is social withdrawal. When hearing becomes difficult, conversation becomes effortful. People stop attending gatherings, phone calls become frustrating. Social engagement reduces, and social isolation, which we will come to shortly, is itself an independent dementia risk factor with substantial effect size. One withdrawal leads to another. The hearing problem that seemed like a minor inconvenience at 60 has become a cascade by 75. The intervention is straightforward. Regular hearing assessment after 50, and hearing aids if indicated, worn consistently, not left in a drawer. Research has confirmed that treating hearing loss with hearing aids reduces the rate of cognitive decline in high-risk individuals. They are not a symbol of aging. They are a form of brain protection. Factor 2. Uncorrected vision problems. Your eyes are the source of approximately 80% of all sensory information your brain receives. When vision deteriorates, from cataracts, from glaucoma, from refractive errors left uncorrected, the brain is deprived of its primary input stream in the same way that hearing loss deprives it of auditory input. The Lancet Commission cited a specific, striking statistic. Timely cataract surgery reduces dementia risk by 29%, nearly a third. Not from a medication, from restoring the visual input the brain depends on. Cataracts develop slowly. People adapt to seeing less clearly, assume it is normal aging, and delay assessment for years. This is a mistake with measurable neurological consequences. The practical guidance is simple: annual eye examination after 50 and prompt action on treatable conditions. Cataracts, glaucoma, correctable refractive error. Every year of restored visual input is a year of restored brain stimulation. Factor 3. Poor sleep and what it does to your brain at night. Sleep is when your brain cleans itself. This is not a metaphor. It is physiology. During deep sleep, a system called the glymphatic system, essentially the brain's waste clearance network, becomes dramatically more active. Cerebrospinal fluid flows through channels around neurons, flushing out metabolic waste products that accumulated during the day's neural activity. Among the waste products cleared by this system, amyloid protein and tau protein, the same proteins whose accumulation in the brain is the pathological hallmark of Alzheimer's disease. When sleep is poor, too short, too fragmented, too shallow, the glymphatic system does not complete its work. The toxic proteins are not fully cleared. They accumulate night after night, year after year. And the person who develops Alzheimer's at 75 cannot trace it back to the decade of poor sleep in their 50s, though that connection is real and documented. Research has demonstrated that even a single night of sleep deprivation significantly elevates amyloid levels in the brain the following day. One night. Consider what years of disrupted sleep does. Poor sleep is not an inevitable feature of aging. It is a treatable condition. What supports better sleep? Removing screens from the bedroom and stopping screen use 60 minutes before sleep. Blue light suppresses melatonin production, the hormone that initiates and maintains sleep. A consistent sleep and wake time 7 days a week, which stabilizes the circadian rhythm. A cool, dark sleeping environment. Breathing exercises before bed, specifically a longer exhale than inhale, which activates the parasympathetic nervous system and reduces the cortisol that disrupts sleep onset. Chronic insomnia is worth raising with a physician, not to obtain sleep medication as a permanent solution, but to investigate the underlying cause and address it specifically. Factor 4. Physical inactivity. Muscles are not simply the tissue that moves your body. They are an endocrine organ, meaning they produce and release signaling molecules called myokines that circulate through the bloodstream and directly reach the brain. Among the most important, a protein called BDNF, brain-derived neurotrophic factor. BDNF stimulates the growth of new neurons, supports the survival of existing ones, and strengthens the connections between them. It is sometimes described as fertilizer for the brain. The primary stimulus for BDNF release is muscular activity. A sedentary lifestyle increases dementia risk by approximately 50%. Physical activity, specifically regular, sustained, moderate-intensity movement, reduces it by the same margin through multiple mechanisms. BDNF release, improved cerebrovascular blood flow, reduced systemic inflammation, and better glucose metabolism. The research is clear that regularity matters more than intensity. 2 30-minute walks per week, sustained over years, produces substantially greater cognitive protection than occasional intense exercise. 10 minutes of daily morning movement is a legitimate and evidence-supported starting point. You do not need a gym. You need consistency and a commitment to keeping your muscles active as the primary tool for maintaining brain health. Because no medication currently available comes close to matching what regular physical movement does for the aging brain. Factor 5. High blood pressure in midlife. Hypertension is one of the most powerful dementia risk factors, and the emphasis on midlife is critical. Uncontrolled high blood pressure between the ages of 40 and 65 causes progressive damage to the small blood vessels supplying the brain. This microvascular damage accumulates silently over years, reducing the flow of oxygen and nutrients to neurons and creating the conditions for vascular dementia. The reason midlife is specifically identified is that the brain is at its most vulnerable to blood pressure damage during this period, before the compensatory mechanisms of later life have time to partially adapt. Blood pressure that is well controlled after 70, but was uncontrolled throughout the 50s, may have already produced damage that cannot be reversed. Know your blood pressure numbers. Have them checked at least annually after 40. If hypertension is present, treatment is not optional. It is among the most direct available interventions for long-term brain protection. Factor 6. Poorly controlled blood sugar and diabetes. Insulin is not simply a hormone for managing blood sugar. It plays a direct role in brain function, regulating neurotransmitter activity, supporting neuronal survival, and managing inflammation in brain tissue. When insulin resistance develops, the condition where the body's cells no longer respond efficiently to insulin, the brain is affected directly. Neurons become less responsive to insulin's protective effects. Inflammation increases. Amyloid clearance is impaired. Some researchers have proposed calling Alzheimer's disease type 3 diabetes, a designation that captures how closely glucose metabolism and brain degeneration are linked. Type 2 diabetes increases dementia risk by approximately 60%, but the damage begins not at the point of diabetes diagnosis. It begins during the years of pre-diabetes, when blood sugar is chronically elevated above the optimal range, but has not yet crossed the diagnostic threshold. HbA1c, glycated hemoglobin, is the test that reveals your average blood sugar over the preceding 3 months. It is a more meaningful indicator of metabolic health than a fasting glucose snapshot. If you have not had this test recently, it is worth requesting specifically at your next appointment. Factor 7. High LDL cholesterol. High LDL cholesterol was added to the Lancet Commission's dementia risk factor list for the first time in the 2024 report, reflecting an accumulation of evidence that elevated LDL in midlife accelerates the atherosclerotic changes in cerebral blood vessels that contribute to vascular dementia. LDL cholesterol contributes to the formation of plaques within arterial walls. In the vessels supplying the brain, this narrows the blood flow available to neurons and creates the conditions for small strokes, many of which are clinically silent but cumulatively damaging. Have your lipid panel checked. If LDL is elevated, the conversation about management, dietary, lifestyle, or pharmacological belongs in your next medical appointment. Factor 8. Obesity and visceral fat. Visceral fat, the fat stored around internal organs rather than under the skin, is metabolically active in a way that subcutaneous fat is not. It continuously releases pro-inflammatory cytokines, creating a state of chronic, low-grade inflammation that damages blood vessels and neurons throughout the body, including in the brain. Visceral fat also drives insulin resistance, connecting obesity directly to the glucose metabolism pathway we discussed. And it is associated with elevated LDL, hypertension, and sleep apnea, meaning it amplifies multiple risk factors simultaneously. The measurement most relevant here is not overall body weight, but waist circumference, a more direct proxy for visceral fat than BMI. A waist measurement above 90 centimeters in men or 80 centimeters in women is associated with elevated metabolic and cognitive risk. Smoking increases dementia risk by approximately 20% and operates through multiple pathways. Accelerated atherosclerosis in cerebral vessels, elevated systemic inflammation, direct neurotoxicity from compounds in tobacco smoke, and worsening of blood pressure and glucose metabolism. There is no threshold below which smoking is safe for the brain. And unlike some risk factors where decades of exposure cannot be fully reversed, smoking cessation produces measurable cardiovascular and cerebrovascular benefit within months to years of stopping, at any age. If you smoke, stopping is the single most impactful health decision available to you. The evidence across every organ system, including the brain, is unambiguous. The idea that moderate alcohol consumption protects the heart or brain, a notion that circulated widely for decades, has been comprehensively dismantled by current evidence. The position of evidence-based medicine in 2024 is clear. There is no safe level of alcohol for brain health. Every amount of regular alcohol consumption produces some degree of harm. Alcohol disrupts the sleep architecture, specifically reducing the deep sleep stages during which the glymphatic system clears amyloid and tau from the brain. A nightly glass taken for relaxation is, neurologically speaking, simultaneously disrupting the brain's overnight cleaning system. It accelerates hippocampal atrophy, measurable on neuroimaging, and raises the risk of atrial fibrillation, which is itself a dementia risk factor through its association with small embolic strokes. Alcohol increases dementia risk by approximately 30% in regular consumers. Depression is not a personality trait or a response to circumstances that resolves on its own with sufficient willpower. It is a medical condition with a documented neurobiological mechanism, and it increases dementia risk by over 200%. The mechanisms are specific. Depression raises circulating inflammatory markers, including interleukin-6 and TNF-alpha, which damage cerebrovascular tissue and impair neurogenesis. It measurably reduces the volume of the hippocampus, the brain structure most critical for memory formation, and the first region visibly damaged by Alzheimer's disease. It disrupts sleep architecture and reduces physical activity, amplifying two additional risk factors simultaneously. Depression and cognitive decline do not simply coexist. They reinforce each other through shared biological pathways. Leaving depression untreated does not protect only your emotional well-being. It directly accelerates the deterioration of brain tissue. Persistent low mood lasting more than 2 weeks, loss of interest in activities that were previously meaningful, disrupted sleep, fatigue, reduced concentration. These are symptoms that warrant a clinical conversation. Depression is treatable. Early treatment protects the brain. Factor 12. Social isolation. The Harvard Study of Adult Development, one of the longest-running longitudinal studies in medical history, following participants for nearly 80 years, concluded that the quality of a person's social relationships is among the strongest predictors of both cognitive health and lifespan. Not the number of contacts, the depth, warmth, and regularity of genuine human connection. Loneliness and social isolation increase dementia risk through multiple pathways: reduced cognitive stimulation from conversation and shared activity, elevated cortisol from chronic social stress, reduced physical activity, and worsening depression, all of which we have already identified as independent risk factors. The brain is a social organ. It evolved in the context of constant, complex social interaction. When that interaction is removed, through retirement, bereavement, physical limitation, or the gradual withdrawal that sometimes accompanies hearing loss or depression, the cognitive stimulus it provided is removed with it. Protecting social connection is not a lifestyle preference. It is a brain health strategy. Real conversation, shared meals, community engagement, genuine relationships maintained actively over time, these are forms of neural protection that no supplement or medication can replicate. Low educational attainment and cognitive inactivity. Lower educational attainment is associated with increased dementia risk, but the mechanism is not about formal credentials. It is about cognitive reserve. Cognitive reserve is the brain's resilience, its capacity to tolerate damage and continue functioning. A brain that has been challenged consistently throughout life, through education, through learning, through mentally demanding work and leisure, builds more neural connections, more redundant pathways, more capacity to compensate when some pathways are damaged. This is why two people with identical amyloid accumulation on brain imaging can present very differently clinically. The person with higher cognitive reserve tolerates the same degree of pathology with less functional impairment. The practical implication is that cognitive challenge throughout life, not just in youth, continues to build reserve. Learning a new language activates neural networks that most other activities do not reach. Learning a musical instrument combines motor, auditory, and cognitive processing in a uniquely demanding way. Reading serious literature, books that require sustained attention, inference, and empathy, has been shown to produce measurable structural brain changes in the direction of health after as little as 2 months of consistent reading. The key principle: new, demanding, sustained challenge. Activities that feel slightly difficult. The difficulty is the mechanism. Factor 14. Air pollution. the most recently added factor to the Lancet Commission's list, and the one most people are surprised by. Fine particulate matter, the tiny airborne particles produced by vehicle exhaust, industrial emissions, and burning, is small enough to cross the blood-brain barrier directly when inhaled. Once inside the brain, these particles trigger inflammatory responses and oxidative stress in neural tissue. Epidemiological research has established a clear association between long-term exposure to high levels of air pollution and elevated dementia risk. The effect is most pronounced in people living near major roads or in areas with high industrial pollution. Individual control over this factor is limited compared to the others, but not zero. Air purifiers with HEPA filtration meaningfully reduce indoor particulate levels. Avoiding outdoor exercise during high pollution periods, when air quality indices are elevated, reduces acute exposure. And at the population level, awareness of this risk factor supports the policy conversations that protect communities. The 14 factors determine your risk trajectory. These early signals tell you whether the trajectory has already begun to manifest. Word-finding difficulty that is new. The occasional tip-of-the-tongue moment is normal. A new pattern of pausing mid-sentence for words that previously came automatically, substituting approximate words for specific ones, or noticeably simplified speech compared to a year ago. This is different. Language simplification is one of the earliest and most consistent markers of early neurodegeneration. Memory for recent events, not remote ones. Early Alzheimer's characteristically preserves long-term memory while disrupting recent memory. Difficulty recalling what was said in a conversation 20 minutes ago, or the sequence of events from earlier in the day, while childhood memories remain vivid, is the pattern that warrants attention. Spatial disorientation in familiar environments. The hippocampus, the brain structure first affected by Alzheimer's, is deeply involved in spatial navigation. Difficulty navigating familiar routes, getting briefly disoriented in known environments, or increasing reliance on GPS for journeys that previously required none, these are early hippocampal signals. Balance changes. The cerebellum and frontal lobes, both involved in cognitive function, also control balance and coordination. Declining balance and declining cognition frequently move together. A simple test: stand on one foot near a wall for support. Adults who cannot maintain this for 10 seconds on either side have a measurably elevated risk of cognitive decline. If any of these patterns are present, in yourself or someone you care about, the appropriate response is not to observe and wait. It is to seek neurological assessment. The window during which intervention most effectively changes trajectory is early. Early is when it is still possible to slow, halt, or in some cases, reverse the decline. Your personalized priority list. Every person reading this has a different combination of risk factors. The 14 are not equally relevant to everyone. Their relative importance depends on your age, your health history, and your current circumstances. What I want you to do after watching this is to honestly assess which of these 14 are currently present in your life. Not the ones that might become problems, the ones that are active right now. Write them down. 3 at most, the ones with the largest effect on your specific situation. And make each one the subject of a specific, planned action, not a vague intention. A hearing test booked. An appointment with your doctor to discuss blood pressure and lipid numbers. A decision about alcohol. A commitment to a specific daily movement practice. A conversation initiated with a family member or friend that has been postponed too long. Small, specific, consistent actions against the factors you can influence are what the research identifies as the path to a different outcome. Nearly half of all dementia cases are preventable. That sentence contains both a tragedy and a possibility. The tragedy is how many people will develop dementia from causes that were addressable. The possibility is what you do with that knowledge from this point forward. The brain that will exist at 80 is being shaped by what is happening at 50 and 60. The habits, the health conditions, the relationships, the sleep, the movement, all of it is writing the story that will unfold 20 years from now. You cannot control your genetics. You can address 14 specific, modifiable factors that between them account for nearly half of all cases. That is not a small opportunity. That is one of the most significant health decisions available to any adult over 40. Share this video with someone in your family who is in the age range where these factors are most powerfully modifiable, between 45 and 65. Not to frighten them, to give them the information they need while the window is still wide open. Leave a comment below and tell me your age and which of these 14 factors you are focusing on first. I read every comment and I want to understand what you are working with. I am Dr. Hameed Ullah Shaheen. Your brain is not your fate. What you do with it and for it every day is.